Hello, I'm James Duddleson, and you're either streaming or listening to dad65.com. That's DADAT 65.com, where you can come and register and you get all the information about the show, future shows. I get to read the blogs, our video blogs, a lot of information that would just overwhelm you. So you go to dad65.com or you can email me with any questions about past shows, future shows. Since we future shows, I don't know what you're going to email me about. It's james at dad65.com. Tonight we have a very important show. Yeah, I know you've heard that before, but it's a very important show because it's a little different. First of all, Erin, my Erin, not our guest Erin, is not going to be with us. We have a contract problem with him. Seems he wants more money. He wants his name in the show like Dad is 65 and Erin. And that was not the contract we agreed upon. I know he's only 8 years old, but he did sign off on this deal. So, and I'm going to hold him to it. So we're negotiating. I'm sure he'll be back for the next show because he wants to get his Roblox because that's his payment for the show. So we'll talk. We'll talk. So tonight's guest is going to be Erin Bogdanski. Now, Erin is a psychotherapist, a psychologist, and a founder of Thera Inc. Thera Inc. is, well, she's going to tell you more about it, but we're going to be talking about COVID and COVID, not just getting COVID, but COVID, how it's treated. I have experience with the COVID, which we're going to talk a little about. But before I do that, I got a lot of emails about the last blog that I wrote about. This is my opinion. I believe you're supposed to have a mask. I believe you're supposed to be vaccinated. There's advantages of having a mask and non-advantages. Well, the first advantage I always find wearing a mask is if I wear the mask, I don't have to shave because nobody sees the bushy beard, number one. Number two, I don't have to brush my teeth. Who's going to smell it? Because I got the mask. And let's see, third, if you're not happy and you're not smiling, nobody knows. So if somebody tells a joke and you don't smile, they go, well, you don't think it was funny? Well, you don't know. You got the mask on. I mean, there's other advantages too. The disadvantage is getting COVID, which could be a problem. From firsthand experience, about a year ago, I contracted the COVID. I was a masker, but, I was a little wishy-washy about the mask. Unfortunately, I got the disease. I was rushed to the hospital in an ambulance. Which is very interesting because that was 8 months ago. I just got the bill from the ambulance. So reminds me, wear that mask. And when I got to the hospital, they knew immediately it was COVID. They gave me the test and I went, oh no, COVID. I'm going to be in the hallways because I heard all the hospitals are just so crowded with people. So I knew there was going to be a problem. I thought maybe they just put me in the waiting room or I wanted to be in the gift shop because, then you can take all the magazines and read, which is pretty cool. But they put me out or I fell asleep and I woke up in a private room. I went, wow, I'm in a private room. This is pretty cool. Wait a minute. I must be really sick. And I was. I spent a couple weeks in the hospital, with nurses coming in wearing all that gear, because I wouldn't even know who they were because you couldn't recognize them. And when the doctor came in, he had this like a spacesuit on. Scared the heck out of me. I said, don't come in at night while I'm sleeping. I'm going to have nightmares. And, I went through the treatment. They tried to give me therapy, tried to get me out of the bed, which I couldn't do because of my oxygen level. And I kept having the oxygen and it was a nightmare for me. And at night, I call Erin every night on my the iPhone, FaceTime, and he'd be crying, Daddy, please come home. And I said, sweetheart, I'm going to come home as soon as I can. And he's telling me how much he missed me. And it was just so much in my heart, how much I just wanted to go home and be with my family. The other problem with the hospital was the food was awful. So I decided I'm not eating this food. I had food delivered. Now, I don't know if that's the rule, you can do it or not, but every day I had delivery of food. I had so much food in my room, I could open up a concession stand. I mean, I had soda, I had bagels, I had lox, just piles and piles of cookies. I'm probably the only COVID patient who left the hospital who gained weight. The bad part also, I gave the disease to Erin. Luckily, at a young age, he was 7 at the time. He got through it all right. I mean, little side effects, but thank God he is okay. But I forgot my original subject was the mask or not mask was the which I'm going to have to go back to. I get so confused when Erin's not here. It's like I don't know. I'm confused. He keeps me straight. Yeah, right. Till you talk to his attorney, more money. He wants what, 1,200 Roblox? It's not going to happen. The deal was 400. Well, I'm getting off the subject now. It reminds me of in the 50s, which I grew up. We had a disease called polio, and it was not like COVID, but it was very serious. Children were getting very, very ill. I remember the pool that we used to swim in was closed because you didn't want to go to the pool because of the because of the polio. You didn't want to catch polio, and then it came out with the vaccine, and everybody got the vaccine. There was no ifs and buts. You got a vaccine. The parents just lined us all up because they cared about their children. I'm not saying people don't care about their children today, but don't you want to protect your family, even yourself, by having a shot? Actually, a couple years later, the polio vaccine came out with what was that? It was like a sugar cube. You swallowed it. So now we go back to the present day. It's like a time machine, a time warp. We're going back and forth. And I said again. I get a lot of emails about that. They say, "Oh, you rub your nose." Well, I'm not picking it. I'm rubbing my nose, if you can't see, because I have allergies. So anyways, after I got out of the hospital, I was on oxygen for about, 3-4 months. And I developed a long haulers disease. And that's another thing we're going to talk to Erin about. It's not just a disease, so it happens after the disease. I mean, it took me about 6 months before I could read a book and focus. I couldn't watch television because I couldn't follow the shows. I would put a show on and I go, I don't understand what's going on. I was able to walk with a walker probably about 3 weeks after being home. But I think what really helped me was I started doing meditation and yoga, which I never did before. Breathing exercises. And I think that's what helped me. Though I couldn't walk, I would take the walker and I get onto the floor where I felt more comfortable and I would breathe. Yoga, breathing in and out, breathing in and out. And I think that is one of the things that really helped me immensely in getting my health back. However, the long hauler stays with you. I think it's been about 8 months, and I think I'm getting a lot better. I'm starting to exercise. I'm walking a mile every day. I'm using like 5-pound weights. I don't think I'll ever go back to the weights that I used to use. Not that I was doing heavy weights, but I liked going to the gym. But I'm feeling a lot better. And we're going to go. Is that Erin? That's not Erin. It's just the part of the show where he always comes in, but he's not coming in. We're back, and I'm with our guest today, a very special guest today, Erin Bogdanski. And did I pronounce that right?
You sure did. Yes, you did.
Okay, because, I've been practicing. Erin is an MA licensed marriage and family therapist, psychotherapist, and CEO and founder of Thera Inc. Correct so far?
Yes.
I'm doing good, right. Little background on Erin, how we met. Erin and I were in Berkeley about 3 weeks ago doing some promos for the show, and we just happened to meet. We started talking, and what she was telling me about what she was doing is just fascinating. And we talked a little about the problem with the COVID-19 with children, and which is very good subject for me because, I was a COVID survivor, and Erin also had, my Erin, don't want to confuse the Erins, It was also COVID. So, Erin, tell us about yourself.
Well, James, I just want to say thank you so much for inviting me on your show. When I learned about Dad at 65, as a clinician, it just really resonated with me because one of the things that I'm hyper focused on right now is how COVID has impacted families. And my passion is working with children that have been impacted by COVID, especially in their natural development, both just their normal development, going through school, but also psychologically how much that's impacted and affected treatment. And so Thera is an early stage startup, and we're pretty small. It's just myself and my VR developer. But I invented the patents about 4 years ago, and the whole concept behind Thera is to see your doctor in a new way. And so if you think of, we are using telemedicine right now because of the contagion. Well, telemedicine's been around for many, many years. It just wasn't adopted as quickly, but now it's exploded. But what I'm doing with my technology is I'm actually streaming telemedicine through virtual reality. And what that means is that instead of actually seeing your doctor on a 2D experience, you're actually putting on a headset and going into what's called 6 degrees of freedom, and you're going into another world, and you're actually embodying a second self. So
Well,
the
could you
actual
do
product
this? Is there an age limit? You can't do it when you're 9, 10, 11, 12, 15. Is it for all ages?
That's a good question, and it really comes down to the type of hardware that you're using. So there's different headsets on the market, and each headset is actually appropriate for certain age populations. So for example, the Oculus Quest is what we use for young adults. You can use the Oculus Quest for a child as young as 9, but any kid under the age of 9, Oculus is not appropriate. However, in the hospitals, they do use Pico Technologies, which is a different headset.
What's
And
Pico
we are
technology? I'm going to interrupt. Pico technology. What
Pico,
is that?
Pico is a different headset, and
Okay.
it's unique because the ergonomics of the headset, the battery is actually at the back of the head. So for a child, you don't have this big weight on your prefrontal cortex, which is, it's burdensome for the child. But the different headsets that are for children, the ergonomics of the hardware is the batteries at the back of the head. It allows the child to be more stable. And I've been researching VR in medicine for years, and one of the things that I really focus on is patient safety, because when you're using a headset, it's there's risks and limitations involved. So when we're using Thera VR, it has to be delivered by a licensed professional. So part of the whole program is that I train and I educate the doctors and the clinicians on how to use the headsets, but also to train and educate the safety protocols for the patient. And it's strictly only being used for psychotherapy. So Thera is not being used for pain rehabilitation or physical rehab or anything like this. It's purely for psych services. And so we deliver cognitive behavioral therapy, DBT, mindfulness-based stress reduction. I'm actually starting to write programs for eating disorders, because that's a really big problem right now in the United States, is children are being admitted like at, and I mean, it's actually atrocious right now, the amount of eating disorder cases in the ER rooms for children. And a lot of that, James, is due to the impact that COVID has put on children right now. And it's quite serious. So one of the things that I advocate is through, not just through my technology, but as a clinician too, is about prevention, right? Like how can we get parents to be aware that, things are happening with their child, but they're not saying anything. And that's where psychotherapy is important, is if your child is struggling with mental illness or even just major depression and anxiety, getting them into treatment is really crucial, more than ever. And to combine that with good parenting, right? Teaching and educating parents to recognize those symptoms of mental illness. Because one of the most important things to remember now is that the contagion has really disrupted our lifestyles, how we communicate, how we bond with people, how we socialize. Just even people have stopped making an analog phone calls to their loved ones. It's really made an impact on children. What is it that makes them feel safe? So going back to the benefits of therapy, and what my technology is doing is it's a little different. It's like, hey, instead of putting your kid in front of a 2D screen and like a regular telepsych experience, we're actually putting them in a world, and there's 7 different scenes, like different environments, and we're putting them in a world where they're not like sitting in a chair like staring at a 2D experience. They're actually like in a space, and I call them safe spaces, where they actually can feel that they can express themselves, and they're moving their bodies, and that's called, clinically, that's called behavioral activation, meaning that you're combining the cognitive experience, the neurological experience, but you're also combining a physical experience. And evidence-based treatment shows that if you move your body, like just exercising or stretching, or I do what's called progressive muscle relaxation, where you tense your muscles and then relax. It's part of healing. It's a part of that mind-body connection, which is,
I'm sorry, is that like isometrics when you with the hands, the pressure, then you relax? It is an isometric type of exercise?
it's similar to this. It's mostly focused on working with someone who is carrying a lot of anxiety. So if you think of a child that's been traumatized, and they have difficulty getting in touch with their body, they have panic attacks, emotional irregulation, getting them to practice a lot of mind-body exercises helps reduce their anxiety. It puts them in a sense of calm and serenity, and that's part of the behavioral activation, is getting them to release that energy, and it works in avatar technology. And what I mean by that is, like, when you put on this headset, this is an Oculus Quest.
Mm-hmm.
When you put this on, the first thing that you see is you look down and you have a second body, and then your mind actually believes that you have this. So think of a child that's like severely depressed, like they haven't left the couch, they've been gaming 16 hours a day, they haven't even gone for a walk. Think of like how damaging that is to their development. Kids are supposed to be out playing basketball and riding their bikes and going out and playing with their friends. Getting them to experience a new way to see their doctor or practice with their therapist, like, okay, well, let's get back to our bodies. Let's go back to what it's like to go for a hike, and at the same time, the experience from the patient is to allow them to like talk about their day. So I've been actually using this on my own caseload with children. And what was remarkable about it, and this is an example, is I was working with a 10-year-old, and she'd been homeschooled for like 15 months. So she was spending 6 to 8 hours on Zoom. And when I started seeing her, I was just seeing her through traditional telemedicine, right? So just a tablet.
Mm-hmm.
And she was unfocused. She was moving around all the time, and actually it was almost to the point where I would observe her to be so anxious just using the tablet that I went back to her parents and I said, well, here, I'm going to give you a loaner headset, and let's try this. Let's try getting her treatment in VR, as telehealth, right? And so she started it, and she picked it up like so fast, right? Like, it's a very simple process. I give her like a password, and she puts it into there's like two fields that you put in a password that makes it compliant. And she picked it up so quickly, and as soon as she started using it, she was actually more comfortable talking in VR, and she started actually sharing more about her trauma. And at the same time, and this was what was clinically fascinating to me, is all of her trauma symptoms actually went away. So this little girl
Wow.
she had night terrors. She had a condition what's called encopresis, which is soiling yourself, and she met all the classic criteria for PTSD. And after I think I saw her for about 3 months using the VR therapy, and her parents came back to me and they said, she's not having nightmares anymore. She's not soiling herself. And I did notice that as I put her through a series of exercises there's two scenes that are really clinically appropriate for children. There's a forest scene and a desert scene. And in the forest scene, um, I I helped her deter from her negative thought process, which a lot of it was due to the social anxiety at school and being removed from her friends. And so in the forest scene, I'm able to do a lot more visual cognitive behavioral therapy, where she's able to project her negative thoughts onto leaves falling off a tree and watching those leaves float down a stream. And then the second process in cognitive behavioral therapy is to replace that negative thought and to practice it over and over again. But it was a fantastic experience because I could really see the benefit of how
It's got
this
to be so satisfying, but it's got to take a big emotional toll on you dealing with children like this.
well, I mean, that's part of the job, right? Like
Yeah.
us doctors and clinicians, we took an oath to do no harm, right? So we
Yeah.
have to develop our own ways to cope with it. But I mean, I've been doing this for years, and even prior to being a therapist, I've worked in really harsh conditions. I worked on the ships when I was really young, so I'm used to seeing a lot of trauma. But the type of trauma that we're seeing now with children, I have to say honestly, if we don't proactively address this, we're going to see a new strain of depression and anxiety and mental illness in young people that we are not prepared for. And I'll tell you why. Is It's not just the combination of the contagion, but kids that have actually gotten COVID, like the early COVID um, patients, like for young people, and they've gotten the antibodies and they're coming out of it and they're going back to school. We are noticing a condition called long COVID, and long COVID
Is
is
that
quite
is
serious.
long haul?
It's the long COVID, which I've seen this in a lot of young people that have come through my private practice. They have really severe depression, but there's almost a patina of psychosis that is associated with it. And a lot of it is due to what's called biopsychosocial measures, being away from that normal development of, being in school, being with your peers, being isolated, and it's really dangerous. So um, I believe that, changing and disrupting how we deliver, psychotherapy now, we really need to try and change, or at least adopt new ways to talk to patients.
Wow.
And just for myself right now, I see that having the avatar technology, but also just the convenience of having this in the home and using it as a telecommunications tool is really profound. I mean, that's what I believe is VR is actually going to be a new modifier. Like that is actually going to be a new telecommunications tool. But the benefit is that you have this full mind body experience instead of just sitting in front of a 2D, a 2D screen. And it's a benefit for psychotherapy because when we are working with you, it's a little different than general medicine, right? We're with you longer. So like when you're having therapy, there's a lot of stuff going on, and it's not just here's a pill, this, put a Band-Aid on you. It doesn't work like that.
Well,
It
Erin,
takes a long time.
I'm going to have to wrap this up because our time, we've got to go, unfortunately, but we'd love to have you back. But tell me, we're going to put down your website so people, if they want to contact you, which they should, in my opinion. What's the website?
www.theravr.io.
Mm-hmm.
And we're really small. Like I said, we're early stage, and so we're fundraising. We're looking to build our team. I'm based in Oakland, California, but we also have team members in New York City. We have a big interest in Texas, but we're trying to get Thera to the pediatric hospitals because that's the biggest need right now. Because a lot of these kids that are going through the ER and they're being discharged, they're not responding to regular telepsych services on tablets. And so that's our goal, is to get into the pediatric space. We're fundraising. We're looking for qualified investors to help us scale. And then our initial mission is to get this into the homes of families.
Right.
And to help support what's called home hospitalization, where we can at least be supporting other telemedicine tools in the home as an adjunct, and to help support parents, because really at the end of the day, it's the parents that are suffering too, because they can't cope. So that's our entire mission, is to support health healing, prevention, patient safety, and to look at this as like, this is a dire time for children, and we need to adopt these new innovations to get people to feel safer and heard. Everyone needs a sounding board, right? And it's like, if you have that there and it's accessible to telemedicine, that's the most important thing for a child.
And I want to thank you, Erin, for being a guest on the show. Tonight's show was a very important show, an important subject. And like I said earlier, I would love to have you back on the show so we could talk about this further. To my audience, please watch the show. Second, please stay safe. Good night.